Good afternoon, viewers, and welcome to this 37th episode of Sunetra Family Eye Care Center's weekly Facebook Live patient education series. These days, when two adults talk between themselves, often the conversation goes something like this. Have you taken the vaccine? Which vaccine? How was the experience? How are you feeling now? Any side effects? And so on. Many of our patients, friends, and relatives seek advice from us on vaccination in a variety of peculiar situations that they might be in. Today, to discuss such issues related to vaccination, we have with us Dr. Valsan Verghese, my MBBS classmate from Christian Medical College, Vellore, who never left our alma mater, postgraduated in pediatric medicine, and is currently a professor of pediatric infectious diseases at Christian Medical College Hospital, Vellore. Hello, Valsan.
Hi, Dr.
He,
Biswas.
he is also an additional deputy chair of Hospital Infection Control Committee and faculty of clinical epidemiology at the same institution. He has vast experiences of having conducted research with vaccine trials, vaccine preventable disease surveillance, and biomarker studies. Sadly, both Dr. Valsan and I would like to put on record that Dr. Usha Titus, who was supposed to join this session with us, shall be missed dearly. We express our joint sincere condolences and prayers to Dr. Usha and her family for the loss of an elderly family member this morning. Dr. Valsan, over to you for today's session, Facebook Live session on vaccine questions. And if you allow me, first of all, welcome. And if you want to say anything, do say. Otherwise, I'll start shooting questions.
Go ahead. Thank you.
Okay. So, my first question to you will be, people often like to know what are the various vaccines available in our country? Are they in any way different from each other? And what do they contain? And things like that. Meaning, tell me if you are able to see the screen.
Yes, I can see the screen. Thank you.
Excellent. So that's the question about the vaccines available in India and what do they contain.
Sure. So everyone knows about Covaxin and Covishield. Covaxin is an inactivated whole virus vaccine, and Covishield is actually a different virus altogether. It's a harmless, non-replicating, which means it cannot reproduce, adenovirus, which carries the genetic code for the spike protein of the coronavirus. So both actually have the ability, once they are in the body by injection, to stimulate the body's immune system to produce antibodies and T cell responses or good immune responses against the whole virus, as in the instance of Covaxin, or against the spike protein, which is produced by the body once Covishield is injected. The other vaccine that is now come, I think a few days back to Hyderabad, is the Russian vaccine, the Sputnik vaccine, and that again is very similar to Covishield, with the exception that it uses a different adenovirus from the one used in Covishield, and it also uses two different adenoviruses for the first dose and the second dose, thereby trying to evade the body's response, or reaction to adenovirus per se, because body can actually have make an immune response to the adenovirus itself in addition to the spike protein of the coronavirus.
Excellent. Very clear. Dr. Valsan, the next question is obvious. Like, how do these vaccines compare with regards to efficacy?
Sure.
If you can
so the data, sure. The data that is here is actually from the vaccine trials, and of these Covishield, which is actually the AstraZeneca vaccine from Oxford, Most of the large data comes from the UK. In addition, there have been bridging studies done in India, and that's something, we normally never take data conducted in a non-Indian population because of probable slight genetic differences in population. So we don't say that if someone has the response is excellent in a Caucasian, that it could be excellent in an Indian, for instance. But so this is data. The Covishield data comes both from the UK and from India, and that the vaccine efficacy is 76%. Covaxin, which is manufactured here, which is the whole virus vaccine, that efficacy is 78%. Sputnik has actually brought out its efficacy just recently, although it was in wide use in Russia, and that is 92%. So to explain what vaccine efficacy is, what we are actually talking about is the definition of vaccine efficacy is disease in the vaccinated as opposed to disease in the unvaccinated. So your disease in the vaccinated is so much less, or to put it this way, 78% less in Covaxin, 76% less with Covishield, and 92% less with Sputnik compared to a population which is unvaccinated. And that is how most randomized trials or clinical trials go.
Okay, great. I would like to pose a question which a couple of my relatives and friends often ask me. That, they say, I have heard that people who got vaccinated also got infected by corona later on. So then, what's the
Sure.
point of taking the vaccine? So, what do you say to that?
Yeah, and I think we are all hearing these stories from all over the country. Remember, we said the vaccine efficacy is not 100%. So you can have the vaccine, and if you have a vaccine which is 72 or 75% effective, you will still, you have a 25% chance of still getting the infection. So that is number one, if you're fully protected. I mean, or rather, if you had enough time after the vaccine. It also depends on whether you went to get your vaccine when you are in the incubation period. The classic story is the Pakistan Prime Minister Imran Khan, whom we all used to watch bowling during our student days.
Yeah.
He was diagnosed to have COVID 2 days after the vaccine. And so obviously he had walked into the immunization clinic harboring the infection in the first 2 days. And so you need a particular amount of time between the vaccine, or rather after the second dose of vaccine, to get your maximum protection. So there's a lot of variables. I just wanted to point you this slide. So ICMR has actually come out with this was a press release that says the percentage of breakthrough infections is 0.02 to 0.04% for both Covaxin and Covishield, or 2 to 4 per 10,000. This second one is just come out in May. This is from a chronic care facility in Delhi, where they vaccinated almost all the healthcare workers. About 2/3 of them had the second dose. What they found is that 16% of them actually developed the infection despite being more than 2 weeks away from the second dose. But that still fits in with your 72%, 76% efficacy. All of them had either Covaxin or Covishield. And both of them are very similar as far as efficacy goes. What is the important point here is that nobody had severe disease. No one needed, had severe disease and needed, admission, ventilation. None of them had a bad outcome. Most of them had some fever, some sore throat, and that
I
was
was
it.
going to ask you this, that even if a vaccinated person has got infected with
Sure.
coronavirus later on, I mean, we know that the severity of the disease is not as much as in a non-vaccinated person, right?
Yeah, absolutely. So this is, again, this data is from the trials, and this is the vaccine efficacy. They look to see, even though your efficacy don't prevent disease in 25%, efficacy against severe disease, death and hospitalization in the trials was 100%. And I think we have some data now from real world, which I think you'll be showing after some time. Because these are small numbers, around 20 to 30,000 for each of the trials. The whole world has become like a lab now. We have vaccinated millions of people. So real world data is also coming in with regards to vaccine efficacy.
Mhm. So then, with all this information, from the point of view of a layman, a
Sure.
patient who's not a doctor, doesn't understand science or medicine, so which vaccine should a person go for if he has a choice?
Yeah, I think that is the most easy question you're going to ask me because we got asked the same question here. So people were arguing, I even have one faculty member who said, I'm waiting for the Sputnik vaccine. Finally, it is whatever vaccine is available. It's, but supply is an issue. The number of vaccine doses that are available versus demand is an issue. So whichever vaccine is available is, that is what you take, whichever country you are in.
One question that comes to my mind is: has there been any study to show that the duration of protection from a COVID-19 vaccine? How long does the protection last? Is
Sure.
it 6 months
So,
or what? What is it?
yeah, so between 3 to 6 months, we know the antibodies stay up at fairly good levels. And the vaccination program started around November, December. In the follow-up from the trials, we know that antibodies, which is persist for about 6 months. The general public who's been vaccinated in November, December in the US and UK, we know that they have persistent vaccine antibodies, and that so we know that it lasts for around 6 months. As the year progresses, you will know how much longer it lasts.
Okay, Dr. Valsan, somebody known to me, a lady, had asked me that she had COVID last year, sometime in
Sure,
October, November. And
sure.
she asked me that because she already had COVID last year, does she need to take the vaccine at all?
Yeah. This ties into your last question, which was how long do I have antibodies after infection? And this is interesting because the antibody levels and the duration that you have after infection depends on how severe an infection you had. Most of the data says that mild infection, less antibodies, shorter duration. Severe infection, more antibodies, longer duration. So, but the duration of that protection is variable. It can be as low as 2 months. And after 2 months, you are susceptible to getting the infection again. So that is one reason to take the vaccine. And the other reason is this slide which you're putting up here. So I
Uh-huh.
just want to walk through that. So you see one little red set of dots on the extreme left at the lower down. That is at the less than 10. Yeah. So that one,
Uh-huh.
those blue dots
Yeah.
are your antibody levels before symptomatic infection. Then the next red set of dots immediately to the right. Now those are your antibodies after you have got your infection. And then you go to the right again. It's pretty similar to the antibody levels that you have after the infection, and you go into the clinic. But what you find is the last set of red dots on your right side, your antibody levels, if you take a vaccine after infection, are nearly 100-fold higher than if you've taken the vaccine without having the infection. So, which means there is actually a survival benefit for you for taking a vaccine after an infection. In fact, what they've done in the UK, made sure that they gave everybody a first dose. They didn't bother with stockpiling for a second dose. They said we are going to have a significant proportion who are infected. Let's give everyone a first dose. So with that, without previous infection, your antibody levels are only as much as you would get with a natural infection. But with a previous infection, your antibody levels are anywhere from 10 to 100 times higher. And those are protective antibodies. So it makes absolute sense to take the vaccine after you had the infection.
Okay, great. Dr. Valsan, if somebody has had a COVID infection recently, not last year,
Yeah.
Then how long should he or she wait before he can take a vaccine? Should he
So
wait?
there are a lot of arbitrary figures being thrown out there. Uh,
Mhm.
One of the recommendations is you wait till your incubation period is over, which is, sorry, your isolation period is over, 14
Okay.
days. Basically, for the very reason that you don't want to walk into a vaccine clinic when you're symptomatic and you get your vaccine and you infect other people who don't have the infection. So that is one logical reason. So a minimum of 14 days.
Okay.
However, we do know that natural infection lasts up, antibodies after natural infection last for up to 8 weeks.
Okay.
So, anywhere between 2 weeks to 2 months after the infection. The earliest would be 2 weeks after the infection. The latest would be within 2 months after the infection.
Okay. Okay. Understood. One other issue that comes to my mind is, see, these days there seems to be a shortage of vaccine all over the world.
Sure.
So people, I mean, has is if there is a situation that if somebody has received one dose of vaccine and is unable to acquire the second dose on time or follow up with the second dose, then
Sure.
how does it fare? I mean, what is the efficacy of one dose of vaccine?
Okay. So this particular slide shows you the efficacy of, or rather, the efficacy of one dose of vaccine on the left side after the Sputnik vaccine, and the efficacy is 70%. Now, this is short-term efficacy. This is not long-term, but it still does protect you in the short term for about 1 to 2 months.
Okay.
So most of the vaccines are taken at a gap of 28 days, where between 28 to 30 days, your single dose is still efficacious. And we do have data from the real world, I think, from Scotland, which is shows population based figures. Think that maybe the next slide, not sure about that.
Mm, yeah.
Yeah. So this is from over a million people vaccinated with the the first dose of vaccine. This was a mix of Pfizer and the AstraZeneca Covishield vaccine. So uh, the topmost line that you are seeing there is actually the overall hospital admissions for the youngest people. The bottommost line is that for the oldest people. So this somewhere around December 15th, they actually started a mass vaccination program. And then the other two vertical lines are the two lockdowns they had. You can actually see that right after the mass vaccination program, infections did not come down. And this is a time when the UK variant was widely circulating. So infections actually went up. But then after January 15th or so, which is about a month after the vaccine, you started noticing that these lines, which are hospital admissions started falling drastically. And the biggest fall was actually in the oldest population, and the lesser fall was in the more younger population. But they fell to levels that were way below the peaks that they had. And this is just a single dose of vaccine in over a million people in Scotland. So when we talk about lab data, one of the issues is, is it applicable to the real world? And it looks definitely like it's applicable. And we spoke about Sputnik at 70% for the first dose. From this data, your efficacy on prevention of hospital admission was 91% for the Pfizer vaccine and 88% for the vaccine that we are getting here as Covishield.
Okay. Okay. Um, uh, Very educative. Thank you. See, you mentioned that one should wait for 2 to 8 weeks time
Sure.
following a COVID infection before
Right.
one can get vaccinated.
Yeah.
On this, another thought came to my mind. Suppose a person develops cold, cough, or fever on the day of the vaccination schedule. Persons get a date for vaccination, and a
Sure.
day or two earlier, person starts getting a cough and cold and things like that. So, should the person go ahead with the vaccination, or should he postpone it?
I think we should wait. And basically, because the coronavirus is, there are four coronaviruses which cause the common cold. So
Mhm.
there's no way that at that point you know whether you are infected with the common cold, some other respiratory virus, or or COVID-19. So one, you don't want to infect other people in the vaccination clinic. Number two, if you have fever and symptoms, it's better to wait till those symptoms have subsided before you, and maybe give it a week or 2 weeks before you go in for your vaccine. I know this is difficult, especially in a situation where vaccine is less available, but I would expect that once we start having more vaccine supplies, I think we should do this. So the practical thing is not to go in and get your vaccine to when you if you have a cold. Otherwise you'll be like Imran Khan and say, I got COVID 2 days after I took the vaccine.
Now, a lot of people keep asking us, I'm sure you also face such questions from patients about side effects of vaccines. So, would you tell us something about the side effects of
Sure.
vaccines?
Sure. So it's interesting because the side effects of vaccine are pretty common across pediatric vaccines and adult vaccines. So there is fever, there are local reactions which are pain, redness and swelling at the vaccine site, and a bit of, you can have myalgia, you can have fatigue. So these are extremely common side effects at some, and it's interesting to notice that these side effects are seen have been noticed to be more after the second dose of vaccine. In fact, so here are the side effects of pain, redness, swelling of the arm, tiredness, headache. Interestingly, headache is a very significant symptom with COVID vaccines. Muscle pain, myalgia. Some people complain of arthralgia, fever, some chills. So these are extremely common, and I think in India we are used to taking, or at least we are used to dragging our children for injections. So we shouldn't be worried too much about this. But this has been one of the major reasons for people in the US not taking their second dose of vaccine. Okay.
Really?
So yes, absolutely. So they've taken their first dose and they're like, I don't want to take my second dose. I couldn't tolerate my first dose.
Okay, I can relate. I can relate it to my personal experience.
Sure.
I had severe firmness and induration and pain at the injection site after my
Correct.
first dose, which lasted for about a week. About a
Oh,
week.
okay.
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 But after the second dose, I had zero symptoms. Zero.
So obviously you had all your immune response after your first dose, and
Mhm.
because a lot, I've actually heard the other way around as well. That is, a bit of the fever, myalgia was worse after the second dose, and
Mhm.
I've heard people who've taken the vaccine say, "Oh, I had nothing. I had only 1 day of pain, or I had 3 days of fever." 7 days is a little, on the longer side, but definitely within 3 to 5 days, this whole thing subsides. Some of our staff were
My
taking preemptive leave with the. Yeah,
okay.
no, go ahead.
My 85-year-old mother, she got vaccinated and she didn't have any symptom at all, either with either of the doses. I mean, she was fine.
Absolutely. Yeah. So I think we should not be worried about these sort of side effects.
Okay.
Yeah. So this is from the CDC website. Talks about tips for reducing vaccine side effects. So what is mentioned is to move your arm after you take the vaccine. Go home, cold compresses. I think we've all done warm compresses for our children when they take vaccine into the thigh.
Mm-hmm.
I think cold compress, whatever works for you, warm or cold, and lots of fluids before and after vaccination. And again, something which most of us remember from vaccinating our children, the commonest pain reliever that we take is paracetamol. It works beautifully both for the fever and the pain. So one dose when you go home, if you're feeling good, one dose at night, and maybe the next day. That should cover things. The one thing that they do say is don't take an anti-inflammatory before the vaccine. So because though, just so that it does not interfere with your body's immune response to the vaccine.
Yeah, some people tend to, I mean, the common people tend to make a mountain out of a molehill about the side effects of vaccine. But then, to the best of our knowledge, any vaccine can have some side effects,
Side
right?
effects. I will. Before I just talked to mountain to a molehill. It's not just the common people. It's our own doctors, our own staff have made. So I was sitting in the vaccine clinic one day, and one person said, "Oh, I feel faint." He got onto the stretcher. This is one of our senior doctors. They were monitoring his heartbeat. His wife came running.
Uh-huh.
So
Okay.
it's not just the common people. All of us, have this fear of what will happen. So I
Mm.
actually was comparing what you can get with the side effects you can get with the ordinary DPT or the triple vaccine, diphtheria, pertussis, tetanus. All of us have dragged our children to the vaccine clinic, irrespective of whatever side effect other parents told us, because we knew that this was important. And if you compare local reactions, so that's your um, local pain, tenderness, swelling. DPT has been noticed to have local reactions up to 51%. Covishield, again 25 to 50%. Fever, much more with DPT. And, if your child ever complained, all you would say is it's good for you. As an adult, you can tell people it's good for you, but, they have to make the decision. Fever, less common with Covishield, 24%. Significant amounts of myalgia, 53% and 65%. And the other thing to remember is there have been reports of severe side effects, and anaphylaxis has been documented with both the American vaccines, like in DPT. Uh, Covishield, which is the AstraZeneca vaccine, has been documented, in the West, the AstraZeneca vaccine has been documented to have complications like cortical venous thrombosis. If you look at the incidence, these are extremely rare, and it's in the normal situation. If this were a childhood vaccine, you would never even have known this had happened till several years, because you don't populate a whole population with a childhood vaccine. But
Mhm.
here, because we are vaccinating millions all over the world, all these side effects, that is the rarer side effects, have now become evident. And then you look and see what is the incidence of these side effects. They are extremely rare. They range from 0.001 to 0.001% for DPT, and these severe side effects with Covishield are again 0.001%. You are
Very.
more, yeah. So I mean, people will say, oh, I've heard there are side effects, and this is much more with our own educated doctors who follow the news, have access to journals. So they're like, I'm not taking this vaccine. Let me look for the American vaccine. Where is the American vaccine? I don't think it will. We'll ever be able to afford the American vaccine at a national level.
I know. A very interesting analogy that you mentioned a bit about when we were small children, when we did not have our own thought process to think and decide, none of us could avoid the DPT and the measles vaccines. And
Absolutely.
we have all got protected. And as you rightly said, it was our mothers or parents who took us to the vaccine center to get vaccinated. Maybe we should have mothers take people to the vaccine center once again.
I know. I know.
Yeah.
If you
Right.
remember typhoid vaccine, do you remember the old typhoid vaccine
Oh,
with our?
how painful it was! How painful it was! Very
It was
painful.
the worst. And I had my first typhoid vaccine when I came to Vellore during MBBS. And by
Okay.
which time, I'm a little more independent. I said, I will never take this vaccine again. The good thing is the current generation of typhoid conjugate vaccines are much less immunogenic, and, you can literally, don't have those side effects anymore. Yeah.
Mhm. I myself had done practical vaccine study with the rabies vaccine when I was
Mhm.
working as an ICMR research fellow under Dr. Jacob John in the virology department.
Okay.
And I went around giving anti-rabies vaccine to a whole lot of staff. And
Sure.
different people had different reactions to that. But yes, people are protected for a year uh, from rabies. Yes, that was.
That's true.
So every
True.
vaccine will have some side effects of the other. So talking now that we know that side effects are rare and nothing much to worry about, uh, Still, are there any contraindications to receiving the COVID-19 vaccination? I mean, are there any situations where a person should not go for the vaccine?
So the one contraindication that is mentioned is if you've had a severe adverse reaction or a severe allergic reaction to the vaccine.
Okay,
Now, how would you and that to COVID-19 vaccine, the or part of what is in the vaccine. So the American vaccines have two things, polysorbate and polyethylene glycol, which is in the composition of the vaccine. So they say if you are allergic to PEG or polysorbate, and you don't even know whether you are allergic to a component of the vaccine unless you've been worked up for allergies, and that's not something we do for our allergic patients. So the only contraindication currently is you go for a vaccine and then you get the vaccine and you seem to have an allergic reaction. That means you should not be taking that particular vaccine. Now, how do you recognize symptoms of a severe allergic reaction? This would include difficulty in breathing, feeling of palpitations or a fast heartbeat, severe dizziness and weakness, and swelling of the face, tongue, or throat. Time wise, the severe allergic reaction should occur within minutes to up to an hour after the vaccination. So, I think one of the recommendations in all the vaccine centers, at least that's what we follow here, is to have you stay there for 15 minutes to 30 minutes under observation.
correct.
So because if you something happens, they are there, they have the equipment to look after you. So there is a full setup uh, dedicated to making sure that a vaccinated person does not have anaphylaxis. So that is one of the things that is recommended. And I would say if you are going to a vaccine center where they say, yeah, you had your shot, you can go home, I would say do not go home till at least 30 minutes or an hour after the vaccination. Find a place somewhere away from the crowd to sit.
Mm.
Make sure you are okay before you start moving. It's a very, very rare side effect, as we just saw. It's 0.0001%, but it's always wiser, safer than sorry, I would say.
Mm. Okay, talking about allergies, the other day
Hmm.
one of my cousins called me over telephone
Mhm.
for something else, and I was asking him whether he has got himself vaccinated. He's elder to me, whether he's
Yeah.
got himself vaccinated, and he said he has avoided taking the vaccine because he has allergies to so many different foodstuffs, to dust allergy and this
True,
and that.
true.
So he is scared to take the vaccine that he might develop an allergy. So what do you think? Like, I mean, say people who have multiple allergies or maybe some drug allergy to sulfur drugs, sulfur
Sure.
group of drugs, some people have. Should they avoid taking the vaccine or
No,
should?
no, no, actually, so that is not recommended. Again, one of the things that I know, there are vaccine centers where they ask you, do you have a history of allergy? And I know there are vaccine centers, not ours, which have actually turned away patients because they said, oh, I was allergic to egg when I was a little baby, but I'm eating 20 eggs a day now or whatever. So, no, 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 you have allergy, you cannot take. So allergies are not really contraindications, and one of the what our doctors do in here, at least they used to do. We have no vaccine coming anymore, so we not running the vaccine clinic, but is to actually take and give you an antihistaminic before you take the vaccine, and those are not really anti-inflammatory drugs. So if you're going to a vaccine center where you think and you're scared, you can always take an antihistaminic, whatever antihistaminic that you would normally take, Avil, Allegra, within half an hour before the vaccine. That is not contraindicated, and you can by all means safely go ahead and take the vaccine.
That's what we do in our ophthalmic practice also. Occasionally a
Sure.
patient is allergic to certain eye drops, something called Tropicacil Plus eye drop, which contains phenylephrine. And
Hmm.
occasional patient is allergic to phenylephrine. But then for a successful cataract surgery, we have to dilate the pupil with phenylephrine. Otherwise, the pupil doesn't dilate full. So what we do
Okay.
is we give an anti-allergic before the surgery,
Sure.
uh, either in tablet form or an injectable Avil form, and then
Hmm.
use the eye drop and do the surgery because doing a safer surgery and better surgery is more important. we
Sure.
can handle
And,
allergy.
and I
Exactly.
think, would you give hydrocortisone as well?
Only not as a preventive thing. Definitely not.
Sure.
Only if it is necessary for an allergy later on.
Yeah. So here also you would not give a hydrocortisone because it's a immunomodulating drug, but an antihistaminic absolutely fine. No worries.
Yeah. So good. So we have talked about allergies, and you want to talk about this benefit versus harm during the
Yeah.
efficacy phase.
Sure. So this is actually, and I'm obliged to our common classmate Dr. Olinda for sending this to me.
Mm-hmm.
So this one is during the second wave in the UK, which was, and they collected this data. The second wave for them started in December and sort of ended by February, March. So this is data from the UK during the second wave. And on the left of your screen is the number of ICU admissions that actually took place during that period of time. On the right of your screen in yellow or orange or mauve or whatever you wish to call it, those are the what do you call it, per 100,000, what were the number of documented serious adverse events. And if you start from the top on the left side, 6.9 per 100,000 in the youngest age group, come down to the over 50 and 60 age group, you have 95 per 100,000 to 127 per 100,000 ICU admissions. And then you look on the right side, and you can actually see that the number of adverse events were zero point 0.2 to zero point 0.4. So whenever for any medicine or vaccine, there's this concept of risk versus benefit, and I think on the left you can see the benefit. COVID is such a terrible disease, and you can see there that older people were getting more and more affected during their second wave, or at least were at higher risk and are at higher risk during the second wave. The benefit of taking the vaccine as relates to preventing these severe outcomes absolutely outweighs the risk of harm. And that is something that is very clear in this particular graphic.
Great. See, I spoke about allergies. I forgot to ask you one question related to that. Can I ask now?
Sure, sure.
See, we have one of our staff members who is a very finicky person. So
Okay.
before he got vaccinated, he did all his routine blood tests and took the reports to the vaccination center to show them that how his blood tests are, the
Yeah.
TC, total count, the differential count, and blah blah everything. So some people are finicky and they want to be very careful. So all that
Sure.
is not necessary, right?
Not necessary. And, I would shudder to think if I walked into a vaccine center waving my investigations, what they tell me. They'll tell me, you either throw that in the dustbin or you can leave. Here we are we are kind. We will patiently listen to that person. But yeah, and the thing is, what will you find? Assume you have that day you have a what do you call it? And bit of an allergy, you're chronically allergic, your eosinophils will be high. To be very frank, none of these investigations are helpful in predicting whether likely to have an adverse side effect. But to be very frank, the risk is so low, you don't need to do any of these tests, to be very frank.
I had a question from one of the women staff of our center that can pregnant or breastfeeding women go for vaccination?
Sure. So I will start with the breastfeeding mothers. In fact, that's an easier question than the pregnant women. Breastfeed, is there a benefit to taking it while breastfeeding? So what people are worried about is, oh, I'm breastfeeding, I'm vulnerable, I have one more life dependent on me. What is interesting here, this data comes from March and April this year, where these are all healthcare workers who were eligible for the vaccine in the US. The figure there is two of those subjects. They had the Pfizer vaccine, and the vertical line is day 21, which is the day that the Pfizer vaccine is given for the second dose of Pfizer vaccine is given. And
vertical
then
line.
you can see that the picture on the right, from zero antibodies in that particular subject within the breast milk, this is not in the breast milk, and after day 21, it went up to very significantly high levels of antibodies. Similarly, on the picture on the left side, and you can see that it stayed persistently there till the end of the time that they measured. The end of the time that they measured was over 80 days, which means we are talking about nearly 3 months.
Yes.
This, I'm sure they'll follow this up and see when it finally wanes, or at least till the mothers get sick of, giving breast milk for, antibody testing. But the duration of antibody protection maternal antibodies in breast milk, we do know lasts up to 6 months. And that is classic because newborn babies tend not to have cold and cough. The first episodes of viral respiratory infection are almost invariably around the 6-month mark. So this is passive immunity. This is a very excellent way of protecting your newborn babies. We do know that younger children tend to have more severe disease, and we don't have pediatric vaccines yet. So, absolutely, I think if you have a staff who's a breastfeeding mother, she should absolutely take the vaccine. And this is one of the, so one, she is not likely to have side effects. Number two, she is actually protecting her baby. And this particular graph was followed by, those are small numbers, by a large number of women from Israel. Again, 2 doses. 97% of them had actual neutralizing antibodies to SARS-CoV-2 infection in the breast milk at levels that would neutralize natural infection. They were followed up for a shorter period of time, but it's absolutely good.
Excellent.
And you did ask me about pregnant women, so I will just walk you down to the bottom of that slide. As of 16th April 2021, and this is not currently a recommendation in India. The reason this is not a recommendation in India is because trials are never conducted initially on children or pregnant women. They are considered vulnerable populations unless a trial shows that there's acceptable risk-benefit ratio in, shall we say, adults. Children and pregnant women are never subjects of trials. Pregnant women especially, because they, a side effect can affect not only the mother but also the baby, the unborn baby. So this is interesting. In spite of the fact that they were not on trials, a lot of women in the US, again, most of them were healthcare workers or associated with healthcare institutions. They said, we want the vaccine, and so they followed up these women. They had to sign a special waiver that said, if anything happens, I don't hold you responsible. But they followed up close to 90,000 women who had Pfizer and Moderna vaccines, and they compared the incidence of any side effect, any adverse event, with that in the general population. And they said the adverse events following vaccination, and which can be anything that happens to you on a trial, is considered an adverse event. If I am a subject on a vaccine trial, I walk across the road, I am hit by a bus, that is supposed to be written down as an adverse event, and it's supposed to be documented whether it's related to the vaccination or not related to the vaccination. So they found that these 90,000 women did not have a higher incidence of adverse events. And based on that, as of April this year, UK has said, please vaccinate all pregnant women. And this is also followed by another study which which showed that vaccinating a pregnant woman, actually, if you did it 6 weeks or earlier before delivery in the 3rd trimester, you actually had transmitted antibodies across the placenta even before the baby was born. So this has not yet, this data for AstraZeneca or the Covishield vaccine has not come out yet. It was not used in the US that much. I'm sure we'll have this data from the UK at any point in time, and that would be another population to vaccinate. The other special population is children. Pfizer, the American vaccines, Pfizer and Moderna, have actually applied to the regulatory authorities for permission to vaccinate 12 to 17-year-old children because they have completed their trials. They are now starting trials in 6 months to 11 years of age. We don't have that data for AstraZeneca or the Covishield vaccine. And these trials in children aged 6 to 17 years old have started in February this year. So, that is the other special population, in addition to pregnant women, who will need to be vaccinated if, for us to achieve some level of herd immunity.
Great. So, from whatever we have discussed so far, if we have to sum up the salient points, one of the
Sure.
things that is clear to me, and I'm sure to the viewers, that COVID-19 vaccination is relatively fairly safe, except in situation where one is known to have allergy either to the vaccine or one of its components or ingredients. There is no absolute contraindication to receiving the vaccine, no other absolute contraindication, right? Is that right?
Yeah, correct. Absolutely.
Number two, what I gathered is whatever vaccine is available these days, I mean, they are all fairly comparably safe, and
Yes,
one should take whatever one gets without waiting
absolutely.
for some vaccine or without trying to choose. Okay?
Sure. Yeah,
And if one has a active COVID infection or ill health due to cold and cough or fever, one should wait for the isolation period to get over before one gets vaccinated, right?
absolutely correct.
Okay. Good. So these are the three good take-home messages that we have had from the discussion so far. And the last question to you, Dr. Valsan, is what is the future? What is the future of COVID-19 vaccination?
So this so nasal spray and oral vaccines. Nasal spray has actually been used for influenza vaccination, and nasal spray vaccines have actually been shown to increase protective antibodies in the nasal mucosa with influenza vaccines, protective IgA, which protects your mucosa. So the aim here is to prevent the coronavirus even getting through your nasal mucosa into your respiratory system. So protective, which so we normal vaccines will give you antibodies, but you can still get the coronavirus sitting in your nose, and maybe you can shed it if you're asymptomatic and infect others. So that is the whole purpose of trying nasal spray vaccines. Oral vaccines are even more interesting. The classic example is oral polio vaccine, which has been used for a very very long time. Now, what is the advantage of oral vaccines? Is biggest is ease of administration. You don't have to worry too much about vaccine centers. Acceptability in the US, they are talking about acceptability because one of the issues the general public there is saying is, I don't want an injection. But when they surveyed them, they said, okay, if you give it to me as an oral vaccine, I will take it, but not an injection. That's not a problem we face here. We are actually desperate to get some vaccine. But the issue for us is needle safety. Even to this day, there are areas where, not in the vaccination centers, obviously, but safe needle practices, bloodborne infections, all through needle stick. So you can avoid all those issues if you have an oral vaccine. You can vaccinate a large number of people very quickly, and you need very few health personnel to administer an oral vaccine. You can get a social worker to go to a large center, a school, and say, okay, here it is, we are starting, vaccine, would you like to have? So there are a lot of advantages to these. There are a lot of these vaccines in the pipeline. However, the earliest that we are likely to see any of these is probably sometime next year.
Mm-hmm. Good. And that holds a lot of promise for the future. Nice.
Absolutely. Sure.
With your kind permission, we can shut down the PowerPoint presentation and do the discussion. face to face. What do you
Thank,
think?
good. Thank you very much for having me. It's always a pleasure to come on to your show.
I'm not yet done. Uh,
Oh, sorry.
See, we touched upon a lot of issues regarding
Yeah.
vaccination. Uh, One last point:
Yeah.
having received vaccination, does
Yes.
a person does a person attain, in inverted commas, immortality? Does he still need to follow the
Mhm.
preventive this
Yeah.
thing, the
Sure. I know. I
masking,
know.
and
This
distancing?
I know this actually feeds into exactly what we were talking about with Dr. Usha last week. Do I still need to? And I think Dr. Jacob John calls this the social vaccine. Masks are, was what he calls the social vaccine. You must remember, like we said, that the vaccination does not give you 100% protection. No vaccine gives you 100% protection. Respiratory vaccines, least of all, respiratory vaccines tend to always give you this degree of protection, around 60 to 70%. So two things. One is, you may still be colonized. Number two, you may still be susceptible. So until and unless all of us follow this, and we are still going to have a certain amount of coronavirus in circulation, and until and unless we reach a stage where we can vaccinate a huge amount of our population, we are still vulnerable because of all the COVID that goes around. So we will still have to. These are good habits to follow, and it's just that I think the general public gets tired of wearing a mask. Why should I wear? Why should I wash my hands? We are such a populous nation. The whole concept of social distance is difficult to maintain. And at least the mask, whatever protection you have, currently we are all wearing masks because we don't have enough vaccine. And I think even once we have vaccines, until and unless the disease literally goes away, we will be forced in our dealings. When you go outside, when you go to the shops, when you go to buy something, when you go to work, when you go to school, masking, I don't think we can let go of any of these, any of the components of the social vaccine, as Dr. Jacob John calls it.
At this point of time, it may be worthwhile to just revise or repeat 2 points which we discussed in last week's session
Sure.
about how to stay safe and about masks. You showed very good photographs from CDC.
Sure.
So we know that a plain cloth mask provides a protection of about 45%, whereas
Correct.
a surgical mask provides protection of about 55%. But both used together with the surgical mask below and the cloth mask above it outside provides a protection of about 85%,
Absolutely.
and that's the best protection. And if the ear loops, the side loops of the surgical mask are knotted and tucked, or tucked and knotted, whatever you call it, then the protection from this double mask increases to nearly 95%. So this is one important point. I mean, for viewers who might not have seen the last episode, that's available on YouTube channel. Type Sunetta Family Eye Care Center. You get all our videos. The last episode was done last week. I think we did it on
23rd.
23rd. Yes. And another important point regarding masks, we discussed that day that research has shown that wearing masks does not compromise with the oxygen saturation of the person. I mean, many people have this notion that when I wear the mask, I feel breathless. So that's nothing but psychological, right?
Yes.
Okay. Right, Dr. Valsan. I mean, I think we have had a wonderful session. I would also like to point out that these days, with social media being full of negative news, even the television being full of negative news, I think there is depression all around us, mental depression,
Absolutely.
and
Absolutely.
many of us are more mentally ill and scared and in panic situation about COVID-19, considering it a dreadful disease. Although most patients, as we mentioned last week, that 85% of the illnesses are mild and
Yes.
only about 13 to 14% is moderate. It's only a small 1 to 2% which goes into severe illness, and
Sure.
that too, people who have some precipitating comorbidities. And the precipitating comorbidities like obesity, diabetes, hypertension, all that can be dealt with by people on their own by change in lifestyle. There is no substitute for living a good lifestyle, eating a good diet, doing regular physical exercise, and staying healthy. No amount of additional vitamin tablets is going to give that amount of immunity as a lifestyle will give, right?
Yeah,
So
absolutely correct.
we must help our viewers tide over the depression and mental illness, so to say, that has been there from the negativity strewn all around us in social media and television. Next week we'll have a session with another of our classmates who will we will talk about how to stay positive in these trying times of COVID-19.
I will
Okay.
most definitely log into that one because I think I need some mental support also. Thank you.
Okay. Cheer up, Dr. Wilson.
Yeah,
Thank you very much and have a good day.
you too. Thank you very much.